More young children in Oklahoma are being exposed to marijuana. Oklahoma Poison Control has seen a 2,000% increase in calls related to marijuana exposure in infants to 5-year-old children. 2 News Oklahoma senior reporter Justin Ayer attended an interim study with the state legislature and found that our state is on track to exceed that number this year.
Accidental ingestions that state legislators say could be prevented.
Thank you.
As a mom to a 3-year-old, Gabrielle Wazin says her weed gummies are nowhere in sight to them.
They're always out of reach. You always just want to put it on the top shelf. It's really best if you lock them away in a fridge.
State legislative committee members of the Alcohol, Tobacco, and Controlled Substances hosted an interim study with the Oklahoma Medical Marijuana Authority, Poison Control, Health Department, and others to discuss prevention measures to the increasing trend.
And when it's getting into our children, I think that's totally unacceptable. And I think we need you to come up with some recommendations on how to make this more protected.
A few ideas were bounced around, like having a tracking system of the amount of THC products customers can get at a time and making them less aesthetically pleasing. The Oklahoma Bureau of Narcotics seized these edibles from dispensaries because they look too much like candy. The state legislature agreed that marijuana edibles shouldn't be colorful with bright colored packaging, kind of similar to how this playground looks behind me. It's very bright. They said in reality, marijuana edibles should be bland.
They don't need to be putting bright colors on it because adults are going to buy it regardless.
The OMMA says all THC products are required to be child resistant, meaning they're challenging for young children to get into, but not impossible, and have warning labels. They also recommend putting edibles in child-resistant containers. But officials agree. When 152 children were admitted to the hospital last year, with 31 in critical care, more prevention and education's needed. Justin Ayer, 2 News, Oklahoma.